Hello, welcome to Dr. Shel Wellness. I am here with Mr. Rubin. How are you today?
I'm well, thank you.
Good. So we are going to do a KYBELLA treatment on Mr. Rubin today. And why don't you tell the audience what bothered you with your chin? What made you come in?
Yes, an additional fat there that makes me look a little bigger than I would like.
And you just want to look more youthful,
Exactly.
right?
Yes.
So Mr. Rubin researched KYBELLA, and KYBELLA is a product that we actually use and inject it under the skin into the fat area to break down the fat. There are a few different things that we can do for the submental chin fat. We can do cool mini, which is cool sculpting, and we have a little applicator that we put here. But in Rubin's case, as you can see, there's this area of fat that he doesn't like. And so what we have done already, and I can kind of show you what we've done. What we do is we first start off with drawing what needs to be outlined as the treatment area. We always go about 1 to 1.5 centimeters away from this mental area, from the chin that is, and we stay away from that because a lot of the nerves travel in this area. So then we go in this area and then just kind of stay above the thyroid. So as you can see, this is the area we're going to be treating. Then we do what's called, it's like a temporary tattoo that is provided by KYBELLA, by the company. And the reason for that is we want to know exactly where we need to inject his chin, but we do it about 1 to 1.5 centimeters apart. So 1 centimeter apart, as you can see. Now the only ones I'm going to be treating are what falls within these lines for safety and efficacy. And so that's kind of what we've done so far. Usually patients will need anywhere from 3 to 6 treatments, no closer than a month apart, because you need to have the body go through this product and do what it needs to do to break down that fat and secrete it and excrete it from the body. So today we're actually going to use 3 vials. We're using about 6 mils. Patients can need anywhere from 2 mils to 10 mils of KYBELLA. It just depends on the area treated and how much fat we have. So with that said, we are going to get started, and this is the product. It's called KYBELLA, and again, it comes in vials of 2 mils. So we're using 3 vials on him, and we're going to inject about 0.2 cc's per injection site. So he's already been cleansed and everything's been clean and all is good to go. I'm going to still dab him with some alcohol because trying to use a sterile technique is most important. And then we'll get started. All right, you ready, my dear?
All right.
Okay, sounds good. This is where my glasses go on. All right, here we go. So we're going to inject, like I said, 2 mils. How you doing?
I'm good.
Good. So what he's going to feel is a little burning after the fact. And you want to make sure that you go to the fat layer and you don't stay superficial, because that's not good technique. How you doing? Good. He's quite comfortable. He's a pro. He's been through worse, right?
Mm-hmm.
Good. Well, he's still smiling, so we're doing good. And that's what we kind of keep repeating and make sure that I go where the dots are, but not right on top of the dots. I go right next to the dot and treat all the areas that he wants treated. And as you can see, I'm staying within the lines. Okay, you're doing great. We're about 1/3 of the way there, okay? All right. And we keep going. Alrighty. And what he's going to feel is he's actually going to have a lot of swelling. The next couple days, he's going to have a good amount of swelling. And that's something that we always tell our patients to anticipate ahead of time. He can still work on a computer, do what he needs to do, but he's probably not going to want to go out tomorrow because of the swelling. And the swelling is anticipated and expected, and we always let our patients know to plan their treatments accordingly. So that's very important. Okay, how you doing so far? Okay?
Good.
All right, fantastic. You're a great patient. Okay, so, and like I said, the worst that he'll probably feel is burning. Is it burning you much?
Not really.
Not really? Okay. It's always good to anticipate it, and if you don't have the burning, then hey, that's good, right? Okay. Okay, so okay. Good. You okay?
Yeah.
Perfect. And we're on our last line now. So he's doing just beautifully. He's a great patient. Okay, as you can see, we're going to stay away from the thyroid, so we're going to be well above that. And I like to put my finger there because, again, safety, safety, safety is everything. And that's the most important thing to me, safety for my patients. To do an effective treatment, but to do it in a way that they get the best treatment with minimal risk. And this is going to be one of the last ones. Got 2 more to go. And you're all done.
Okay.
How was that? On a scale of 1 to 10, 10 being very painful and 1 being not bad.
3.
Good. So that's great. Now what I like to do is just kind of hold a little pressure, and we're going to then just put some ice on it, and we will put a little bit, wet wipe this tattoo off with some alcohol again, and then he'll go home and just rest. And if he has a little discomfort, then he'll ice the area. Can I have the ice bowl, please? Mm-hmm. Yeah. So ice will actually feel good in the area, and if you look to see, you can kind of see the entire area has been injected, and you see a little bit of swelling already, and that's normal. That's to be expected. And so we're going to just ice it a little bit and let him just relax and be comfortable. And when you're ready, Mr. Rubin will take off the marks, and you'll be able to go home. Sound good?
Perfect.
All right, so we'll be taking some post pictures for Mr. Rubin, and he'll let us know over the next couple of days how he's doing, how he's feeling, so stay tuned. Okay, thanks for joining us today. And again, that was KYBELLA. And if you're struggling with some submental fat in the chin area, and if you'd like to come in for a consultation, just go to our website, drshel.com, and be happy to see you for a complimentary consultation. For Mr. Rubin, we're actually doing one more thing. We're going to be doing a tight lace laser. Let me just show the viewers what we're talking about, because we'd like to tighten up some of the skin. So we'll get rid of this fat, and then we're doing tight lace laser to tighten up some of the skin. So he's going to have the chin and the neck of a 20-year-old. All right, thank you. Bye-bye.